Hi everyone. Today I want to talk about health hazard management. Health hazard management is an area of focus not only for New Zealand but for the world. We have all seen statistics that show the numbers of people killed by health hazards is much higher than those killed by acute safety accidents. Balance is needed for health and safety management by maintaining continued focus on safety and increasing focus on health. I completely understand why there has traditionally been a higher focus on safety. Safety failures can result in acute injuries, including death and disability, and safety injuries often hurt. Health hazards can also result in acute injury, including death, think carbon monoxide poisoning, but most of the death and disability occurs from long-term illnesses and injuries such as cancers, neurotoxic effects, and noise-induced hearing loss. I often find myself thinking, I wonder how well we would be managing health hazards if breathing in a substance at harmful levels resulted in pain. To try and bring some balance back to health and safety, I'll be going through these three key aspects of health hazard management: management of hazardous substances, health hazard training, and exposure monitoring. Next, I want to talk about my favourite regulations, the General Risk and Workplace Management Regulations, or GRIM for short. The reason these are my favourite regs is because they mention exposure monitoring, and as an occupational hygienist, that makes me happy, as we tend to fly a bit under the radar. Regulations 5 to 8 apply right across the health and safety system. In short, they say you must identify your health and safety hazards and apply the hierarchy of control. You must maintain your control measures so they remain effective, and the control measures need to be reviewed. Maintaining controls related to health hazards are often neglected. Ventilation systems are commissioned but not maintained. They get clogged with dust. The fans get out of balance. Staff aren't trained in how to use them properly, and I could go on. Reviewing control measures can be assessed during an audit, but this regulation also discusses the need to review controls when a new hazard is introduced, and when a health monitoring or exposure monitoring report is received that indicates harm has or may be done. How often is this done for health hazards? If a new paint with different types of solvents is used in the workplace, is the health risk assessed? Will the current respiratory protective equipment filter out the new contaminants? Will the existing extraction system draw enough solvent away so exposures are below the workplace exposure standards? These are the questions the GRIM regs should be invoking. Then, of course, we have the regulations which directly relate to exposure monitoring. Regulations 28 to 30 and 32. You need to manage your health and safety risks associated with hazardous substances, and if you're not sure if the exposure levels are well below exposure standards, you need to do exposure monitoring. The exposure monitoring needs to be done by a competent person. You can find occupational hygienists on the HAZANS register, and you need to keep records of exposure monitoring for 30 or 40 years, and exposuring needs to be repeated. It's not a one-off check, it's a continual process. Now let's talk about hazardous substances management. When businesses think of hazardous substances management, they often think of location compliance certification, certified handlers, stationary container certification, or other pieces of paper required under the hazardous substances regulations. But what about requirements for substances which don't meet location compliance certification thresholds? There are still requirements under the hazardous substances regulations to manage them. The purpose of the hazardous substance regulations is to protect people and the environment from the adverse effects of hazardous substances. One of the ways to do this is by mandating that someone with expertise, a compliance certifier, checks various aspects of compliance, such as LCCs, etc., as mentioned earlier. Now, this is a very important part of the process, but there are other aspects of the regulations which apply to general management of risk, and a lot of these relate to identification of your hazardous substances. These include maintaining an inventory, knowing the hazardous properties of your substances and ensuring they are kept separate from substances which can cause an adverse effect. Seems simple enough. Know what you have, how much you have, the hazardous properties, and keep them in their correct bubbles or storage locations. Proper identification and segregation is your first line of defense in minimizing harm to people. Yet we still see flammable liquids stored with oxidizers and flammable aerosols with flammable solids. Another important tool of the inventory is that it shows what you have and can highlight what you don't actually need. If you don't need it, dispose of it, properly of course. By getting rid of excess substances, you save on management costs, you potentially negate the need for an LCC, and most importantly, you eliminate the risk to your team from those items. The greatest risks can often be from the hazards that are forgotten or not anticipated. There was one client who used LPG for forklifts and bird deterrent guns, and they kept some of their 9-kilo cylinders in a shipping container. The container held up to 2,700 kilos of LPG, which was just a little above the certification requirement of 100 kilos. A site inspection was undertaken, and the location was found to be compliant with regards to storage of the cylinders. It was locked, there was good signage, no incompatible substances, fire extinguishers were present, it was away from public places, etc., etc. The hazardous atmosphere zone was documented and being managed well. So, from a certified standpoint, it was a compliant store on that day with all the necessary documentation in place. The bird deterrent guns were being used regularly, and there was a significant number of cylinders empty in the store awaiting pickup and replacement from the LPG supplier. One employee thought that the cylinders needed to be completely empty for transport. So, what did they do? They unscrewed all the tops of the LPG cylinders to let them fully empty. This in turn essentially created a bomb. LPG gas inside a shipping container, which could have had disastrous effects for people working on site. Thankfully, another staff member walked past, smelt the LPG, and notified their supervisor, who in turn called 111. The fire service and police attended and safely ventilated the space. I think this shows that what can be fine and dandy one day can be extremely hazardous the next by an action of someone meaning well, but not understanding the hazards and not talking it through with a supervisor beforehand. This would have never been captured in an audit because it would never have been considered as a likely scenario or as a normal practice. Whilst training certainly plays a part in this, what trainer would think to say, don't ventilate LPG in a confined space? It seems common sense, right? So what could have prevented this? A standard operating procedure, better supervision, maybe a more open culture around communication. Under the multiple pieces of legislation, there are requirements for training. Training in the hazards that people encounter during work, training on how they use the equipment, training on how to properly use PPE, etc. All too often in workplaces, I see people handling hazardous substances and they have absolutely no idea what the health hazards are. They might think it's just paint, but that paint could have toluene in it, which can absorb through skin and cause organ damage. I saw a hand cleaner on site a few weeks ago, which stated in the SDS that it contained formaldehyde. Now, formaldehyde is a carcinogen and is also sensitizing, not something that you want to be putting on your hands. I later found out that the product had been replaced and it no longer contained formaldehyde, but the SDS wasn't updated in the workplace. The manufacturer had to change their formula as they weren't allowed one of the ingredients in the hand cleaner anymore. No surprises what that ingredient was. What this highlights is that some workers tend to only take precautions if they are told to. Some supervisors only tell workers to take precautions because they are told to. Workers and managers should be more questioning. What is in this product? How can this affect my and my team's health? Why do I have to wear gloves? Why does this product dry my skin? External training is a valuable tool to gain some expert knowledge, but the flaw with external training is it looks at the current state of the workplace. What if the workplace changes? What if a new product is introduced? What if a new process is introduced? These types of changes can generate new hazards which need to be identified and managed. Workplaces tend to do this quite well for safety hazards, but what about hazards from hazardous substances and from other physical hazards, such as noise, vibration, and lighting? Health hazards are not being considered as well as they should be. I've seen SOPs which have great information on safety hazards and then just say, wear respiratory protective equipment. Why? When? All day or just during a task? What for? What filter should be used? What type of respirator? Half face, full face, disposable? What about fit testing? What if people have facial hair? What about training and how to use and store and maintain a respirator? As part of a team member's training, they need to understand the health hazards of different aspects of their job. They need to know that a particular solvent is a carcinogen, that it causes cancer, and therefore they need to take extra precautions when using it. They need to know that cutting concrete can expose them to crystalline silica, which can scar their lungs. This should be just as common as someone saying, this part of the machine has a pinch point, which is why there is a guard on it. In our next case study, the worker had no idea what hazard of the fairly innocuous seeming substance was. I was doing some occupational hygiene exposure monitoring on a drainage crew who were installing manholes for the stormwater system. They would excavate an area, lower in the manhole, and then cut a square hole in the side wall for a PVC piping to go through. To block up the open area left by a round pipe going into a square hole, they were using a 2-pot epoxy mortar. The resin and hardener had to be kneaded by hand for some time before it was applied to block up the hole. The guys wore heavy-duty disposable latex gloves while they were doing this. As it was a hot northwest Canterbury day, they were wearing t-shirts and shorts with their work boots and hard hats. Upon reading the safety data sheet for the mortar, I found that both the resin and hardener are contact sensitizers. Sensitizers are substances which can lead to an allergic reaction after repeated exposure. For contact sensitizers, the area affected is typically the skin. So whilst the gloves were protecting their hands, they were not protecting their forearms or legs from spatter and direct contact during application. So did they know why they were wearing gloves? Not fully. They were wearing gloves just to keep their skin clean, and I suspect to also stop the mortar drying on their skin, which is then hard to clean. This is speaking from personal experience, as my husband is a builder and has come home with epoxy on his hands. And yes, I see the irony there. He also has a beard, so I won't even go into the conversations we've had regarding respiratory protection. The supervisor and manager I spoke to didn't know that the epoxy was a sensitizer. The supervisor didn't know what a sensitizer was. Safety data sheet wasn't reviewed before use because, hey, it's just mortar, right? It doesn't smell, it doesn't burn the skin, it seems quite safe. But long-term exposure could cause an allergic reaction that those drainage operators won't be able to use that type of mortar and other substances containing the sensitizing agent, which could affect their job security, as well as complications from dermatitis and other skin conditions. Training could have educated both the workers and the supervisors on how to read and understand safety data sheets, how to understand the different terms used, and how to assess a new hazard brought onto site. Health and safety is a continual process of learning and questioning with the aim to improve workers' short-term and long-term health outcomes. Despite some of what I've discussed, managing long-term exposure to health hazards is something that I am pleased to say is gaining traction in New Zealand and around the world, and it's needed. But a lot of businesses still don't know what a good occupational hygiene program looks like, let alone how to implement one. This is the occupational hygiene cycle. Looks similar to a lot of other cycles you see in health and safety management, right? Anticipation, assessing hazards before they are introduced, like the epoxy mortar I just spoke about. Recognition or identifying your hazards and knowing which hazard poses the highest risk to worker health and which workers are potentially exposed to it. Evaluation, assessing or measuring how that hazard could affect worker health and whether something needs to change, and of course, control, determining what controls are needed, implementing them, and checking their effectiveness. The first steps in implementing an occupational hygiene program is a basic characterization, which means identifying your current exposure hazards, understanding how those hazards are generated in the workplace, determining who can be exposed to those hazards, and ranking the hazard based on qualitative exposure risk. From this, the exposure assessment program can be planned starting with the highest hazards first. Exposures are grouped by SEGs or similar exposure groups, which will allow us to assess and control exposure for groups of workers based on their work type. It means that we don't have to monitor each person for each workday to gain an understanding of exposure. This process is based on statistical requirements in standards such as EN 689. Workers can be present in more than one SEG if they perform multiple roles for the business. During the basic characterization, we may also find that there are hazards which are clearly in breach of guidelines and controls are needed immediately. If this is the case, we postpone the evaluation step and don't undertake exposure monitoring just yet. We instead instruct the PCBU to put in controls. Once the controls are implemented, we then go back and measure exposures to assess effectiveness of those controls. For hazards that don't need control straight away, we can start the evaluation phase. This involves undertaking the exposure assessments, which can include measurement of airborne contaminants, noise dosimetry, skin exposure assessments, lighting surveys, or a more in-depth qualitative assessment for a particular hazard and task. Data that we collect is often compared against workplace exposure standards or other guidelines to quantify the risk. We can then suggest and assist in implementation of controls to reduce exposure if needed. Discuss PPE options for either long-term or short-term use, and make recommendations on whether health monitoring should be considered. We also advise on a reassessment plan as exposure hazards need to be assessed on an ongoing basis, hence an occupational hygiene cycle and not a one-off assessment. During an exposure monitoring job, we were asked to assess the dust levels for one particular joiner at a joinery manufacturing facility. The work was due to the operator being concerned about dust, so we were asked to only focus on his activities. This is not ideal, but we needed to start somewhere. We did some exposure monitoring and the results showed that there was elevated exposure caused mostly due to the sanding activities done as part of his role. The sander had on-tool extraction, but the circular motion of the disc meant it wasn't capturing as much dust as needed. This company really got on board with working out a solution for this joiner. They considered the options and decided bench extraction was the way to go. They made extraction prototypes and refined their solution until they got something that they thought was working quite well. I was called in for a meeting and they told me all about the process. It was great to see their enthusiasm and they worked really well as a team to find a solution. I had a look at the extraction and it seemed to work quite well from observations of dust movement. We re-monitored and found the dust levels had been significantly reduced, but they were still slightly elevated and we needed to reduce them a bit further. So the next steps were to look at additional controls, and this is where the company is at the moment. When I was at the meeting and the team were telling me about the control, they were so excited, and I said, that's great. Now how about we implement an exposure monitoring program for all the other joiners, CNC operators, edge banding operators, etc. Let's see how their exposure is. Maybe there are other people that have elevated exposures too. Sadly, the response I got wasn't particularly enthusiastic. It made me wonder why. Did they not understand their obligations under the GRIM regs? Were they worried about costs? Did they think the other parts of the factory were okay? I'll continue to work with this client as best I can to improve worker outcomes. Exposure assessments are not a one-off item. They are a cycle, just like so many things in health and safety. By having a robust occupational hygiene program with regular targeted assessment, you can be sure you are identifying your hazards, evaluating them properly, and implementing controls to minimize exposure. This means you'll be minimizing the likelihood of occupational disease and death for your team. So how can we bring that balance to health and safety? As I mentioned before, exposure to health hazards doesn't typically physically hurt. And this makes it more difficult to resonate with the potential hazard. I think this means that businesses need to better understand health hazards and terminology so they can recognize health hazards just as easily as they can recognize safety hazards. During procurement of new machinery, new substances, there needs to be more of a focus on the health-related impacts that they pose. Those impacts could be cost-related, such as requiring compliance certification, requiring more PPE or different types of PPE, an increased level of training. They can also be directly related to the short-term and long-term health of their team, from things such as carcinogens. Maybe the plant has an inbuilt ventilation system, or maybe they could consider buying quiet. While I appreciate health won't be the primary factor for consideration, at least give it a voice. At least consider it. At least think of the impacts to your team while they work for you and in their retirement. And last but not least, and I may be slightly biased, implement an exposure monitoring program. Understand your health hazards, eliminate them if you can, and if you can't, evaluate them, control them, and continually reduce the risk to your people. Thank you very much.